Well, it it's gone very quickly, which is pretty amazing when you think that I've been here 14 years and I've been in the CEO role since 2011. And I think of all the things that have changed in that time since I became CEO. But clearly, it was a team effort. I've been thanked for my leadership, which I greatly appreciate. But my belief has always been that it's the team that pulls it all together. So every one of the 500 people who walk through our doors every day, whether it's in Dansville or Geneseo, you are the ones that make it happen. When patients come here, all of our employees are the ones that make them have a positive experience at a time when they are probably most vulnerable in their life. So I think it's really important that this is my message today, is that this is my time to thank all of you. You are the ones who have definitely made Noyes successful. And when I think of the year that we've been through as a pandemic year, it's been very challenging. Everyone came to work not knowing what was going to be happening. We had to learn how to protect ourselves and protect our patients while we waited for treatments and we waited for vaccines. And that meant sometimes changing our practices on a day-to-day basis as our body of knowledge grew every day. I mean, we were a living experiment here, or living research, and we still are to a certain degree, but we're in a much better position now than we were a while ago. And I have great respect for everyone who walked through these doors every day in the midst of a pandemic. It was a hard thing to do. At the time that I took the position, we were in a bit of a challenging position, both financially and also from a strategic standpoint. We were a standalone institution back then. And I think slowly over the years, we bonded together for common goals. We became an affiliate of the university, which was a key strategic initiative that we had to do. It's almost impossible for a sole community hospital to stand by themselves in the manner that we deliver healthcare these days. It's better for us both financially, but more importantly, clinically. The things that we have today would have been very difficult to have happen without that affiliation with the University of Rochester. I think first I have to thank the board, and most people who work here probably don't have a reason to understand what the role of the hospital board is. First, they're volunteers who give a lot of their time to help set the direction for the organization. And that sometimes means that they have to think broadly and have vision of where the hospital should go and how will the hospital still be here. What do we have to do to make sure the hospital is still here and we're able to deliver care to our community? So they had that vision. So first and foremost, they were very supportive of where we needed to go, what we needed to do to be successful. The administrative team here, we're a very close team and we work together, but beyond that, every single person in this organization makes a difference. Whether you directly interact with a patient or you don't, you contribute to the outcome for how patients perceive their care here. Everyone does. Well, certainly the biggest physical change was the emergency department. We were the recipients of a grant from New York State to get that project started, and then we began a capital campaign to raise the rest of the money needed to complete that project. So our emergency department went from 3,000 square feet to 10,500 square feet, and it's a beautiful workspace and it's a great space for patients. Right on the heels of that project finishing, we went into the plan to develop the Anna Carl Myers Cancer Center here, which is an amazing project bringing cancer care to our community. And then almost at the same time, we were able to acquire the building where mental health services were able to move into the wonderful space where they are today. I think it's just watching progress and watching every employee be happy with that progress, be proud of the things that we've accomplished. I would have to say it's the people here. That is the main reason I took the position when the opening was there, is that I felt that if I were ever going to be a CEO, I couldn't think of a better place for that to be than here at Noyes, because I knew the people here and I knew that they would work together for success. And I was not disappointed. I don't have plans, which is kind of nice. I'm looking forward to enjoying summer, hoping summer gets here. And then I will figure it out from there. So my first plan is to sit on the front porch with a cup of coffee in the morning. You know, I've been working with Chad for the last 4 weeks, and I think if Chad is just himself, he will do just fine. He is a very caring, sincere individual, has a good sense of humor, a very open style of communication. And I think he's actually just going to step into the role just as in the same place where I left it. I really do think that his personality is going to mesh very well with all of the staff here. Plus, I think he brings the skills of his knowledge, obviously as a physician, but also the relationships he has with many people at the university level that can take Noyes to the next level. Just a very heartfelt thank you to everyone.